Don't be rude to anybody.
Okay.
It'll leave scratches on your voice. From the corporate field, why I get a lot of them from there is
Okay.
they do have presentations, extensive use of the voice.
Hydration is...
How extremely important. You may not be having a clinical dehydration, but you may be having a vocal hydration, which the body will manage. People come to me and say, you know what, I lost my voice.
Okay.
Then I have to tell them, and how are you talking to me?
Okay. And the internet that says that Michael Jackson has a speaking voice and a singing voice, and you don't know how Michael Jackson really sounds like, right? Are there cases like this?
There was a famous singer in Kerala who fell off the second floor. So while falling down, she screamed. So while falling, she's screaming
Okay.
out of fear.
Huh.
And then there is a small blood vessel which breaks.
Do these 5 hacks and you can manage the situation.
So first,
Most of the singers are your top singers in the country, right? They day in and day out, they have events. I used to wonder, how do they maintain their voice? Can you mention
no, I'm not allowed to.
actors, okay? Singers?
The K.S. Chitra ma'am, P. Unnikrishnan sir, Nityashri Mahadevan. These are the names I'm allowed to mention. Gut health is the heart of voice health.
Your voice can open doors, inspire audiences, close deals, and shape the way the world perceives you. Today we are speaking with Dr. Shyamala, a renowned voice coach and therapist whose expertise have helped some of the nation's leading singers, performers, and corporate leaders discover and develop their voice of impact. I am Gopal Raj, and in this episode, we explore the science and art of vocal excellence, the connection between voice and confidence, and practical techniques to strengthen and elevate your voice. Let's dive in. If you find value in the show, hit that subscribe button right now. We are committed to bringing you the stories and expert insights you need to stay ahead of the curve. Don't miss the next deep dive. Subscribe today. Welcome to the lab, Dr. Shyamala. Right, we are so happy to have you here, and we are going to talk. We are going to kind of delve into a subject which has not gotten as much importance as it should. That is the voice, right? And voice is something which has so much of impact in our day-to-day life. And I would really want you to kind of dissect this, give us insights, give us, do-hows of how you can get a good voice, right? How you can train yourself to have a good voice, have greater impact, at corporates and in the society itself, right? So first, thank you for joining us here.
Thank you very much,
Okay.
Gopal. Thank you.
So we'll start off, ma'am. So first, we'll get to, what do you do, right? For the audience, what do you do? What is your background? I do know that, you're a voice coach and a therapist, but we would like to hear your version, your description from you, right?
Yeah. So I'll try to make the long journey brief,
Okay.
Gopal. So basically, I'm a professor of music.
Okay.
So I started singing very early in life.
Okay.
And my father's passion for music made us together decide by the time I was 10 years old that with God's grace, music will be my journey. So I was singing on stages, light music, without getting trained. Film songs, devotional. And fortunately, I got in touch with stalwarts like Janaki Amma and others. So I used to get a lot of advice, but not a formal training. Until one particular competition, I got the great fortune of meeting Srimati Vani Jairam Amma. She's no more.
Okay. Okay.
So she was a judge for the competition, and after the competition, I don't know what to say. It is like God coming down on earth. She just walked up to me and said, "Come home.
Okay.
I would like to teach you certain techniques." In that competition, I sang one of her film songs. And so then I go to her. She starts training me. That was, I think I was 14, 15, 16 years, those 3 years.
Okay.
That's a period also when I met more singers because of my stage performances and interest, of course. So those days we don't have the social media. So we do go and see them on stage. Then we wait at the backstage to meet them and, take their blessing. You know how it
The
is.
fanfareship.
Yeah,
right.
fan. So the fan moments. Slowly, God's blessing again. Many of them would remember me, and I go for the programs and they say, oh, you're that person. And from lot many quarters, I got this advice that I take up music as my main subject after my 12th standard.
Okay.
So I ended up joining Bachelor of Music, Bachelor of Music, Madras University. So that is when I'm introduced to Carnatic classical. Though I've been listening, I was learning Hindustani classical from Vanicharam Mama.
Okay.
And semi-classical Hindustani. Then I come to Carnatic here. Then the journey is still going on, the learning process. After my BA, of course, Masters, then MPhil, then I get married and I start singing for films and, but there was something running parallelly along with this, Gopal.
Okay.
I always had this, curiosity about voice.
Okay.
So any voice, if I hear once, I would try if I can identify later on when I hear, like this is so and so's voice. This particular song, we depend on Vivid Bharati and Geetmala. We
Correct.
don't have.
This was the time of the radio, right?
Excuse me, yeah, exactly.
So radio, you could recognize the
once
people
if I
by
hear,
the voice.
Like the Pakistani
and they were
singers
celebrities
also.
themselves, right? I mean,
Most of them.
their
And
own
even,
right.
The night we used to get Pakistani radio, the ghazals.
Okay.
So I was able to understand, or find out that this is Pinaz Mazani's voice.
Okay.
When my father used to say, how you're able to say that? I didn't know how it is. But if I hear it once, and if somebody else is replicating a popular song, I would say, no, this is not the singer.
Okay.
So fortunately, I was also doing Mellise in Madras radio station.
Okay.
So I had the great fortune of getting trained by, composers those days, Shyamala Swami, Jayashree Jagan, T.R. Papa. They were the great composers those days, All India Radio. So they used to play tricks with me, They used to play old records.
Okay.
So if I had heard the voice for the first time, I would keep it here. And the next time they play the same person's a different song or a different shruti, pitch.
Okay.
I was able to, identify
that. Okay.
So then this curiosity is always there. I study the voice, how they go high. And so this interest has been going on. After my MPhil, the usual, you get married, go abroad. My husband was in the Gulf. That's when I got interested in Arabic classical.
Okay.
So we were in Oman.
Arabic has classical?
Of course.
Okay.
Yes. The same question I asked there.
Okay.
Because when I went to Oman, 1989.
Okay.
End of 1989. We rarely hear anything which is classical. So it took some time for me to understand the difference between the popular Arabic music, here we call it film. It's just not film, it's popular music. And very rarely, here and there, classical music. So then you're all the more curious. So then we start finding out. I had completed my MPhil by then here, Madras University. I had actually started my PhD on a different topic.
Okay.
But then
you started your
after
PhD
my MPhil,
after your MPhil in Oman?
No, Madras University.
Madras University.
Everything is planned.
Okay.
But then the rule came that I have to be there in Chennai.
Okay.
I can't be in Oman. In spite of the fact that I was working for Indian School Muscat as a music instructor. So I thought maybe I'll get a part-time slot because I'm working there, but it didn't work. And then so I'm just trying to find out how I can have a larger picture of classical Arabic music.
Okay.
So it is like, God is planning for you everything, that universal power. You have the quest you want to know, and the universe is helping you. That's when we met. my husband and myself met the great Dr. Yaqub Mohammed.
Okay.
So he had come from Egypt
Okay.
as the conductor of the Royal Oman Orchestra,
Okay.
Sultan Qaboos's orchestra.
Sultan Qaboos is the Sultan
king
of
that time. Oman.
Oman.
At that time.
Correct.
He was also heading a coming up music department
Okay.
at the Qaboos University because there is no classical music. That's when I came to know classical music was not practiced in Oman.
Okay.
Most of it was fishermen music.
Okay.
So they want to bring it from Egypt because Egypt is considered as the seat of Arabic classical music. So Egyptian classical music is synonymous with Arabic classical
Got
music.
it.
So my husband, Vinod, is a very good singer and passionate about music. So he said, come, let's go deeper into it. So we just meet Dr. Mohammed, and it was not a casual meeting. To get an audience with him, we really had to pull strings at the embassy and all that. Then as we started the conversation, it eventually led to, he saying, I would like to know more about your theory. Since you've completed your MPhil, let's have an exchange
on
program.
music.
Yeah.
On music.
On
Okay.
our Indian style.
And Arabic.
Which was what we were waiting for.
Okay.
So then we come home, and then my husband says, then why don't you do it academically?
Okay.
So then it is more authentic, and then the time that you're going to spend on this will be more defined. So he sowed the seed for it, my husband. Then we get in touch with Madras University because my people who have shaped me as a researcher at MPhil, the great Dr. N. Ramanathan sir. So if we speak to him, then he says, see, you are already there and you have spoken about this to us. Now you have to do a comparative study.
Okay.
Because nobody has done it before.
A comparative study between
Of Arabic
and
classical
Carnatic.
music. Yeah, so it's a very wide topic if you say classical music. So the basic structural approach.
Okay.
So that's what we wanted to understand.
Okay.
So then we decided.
As a researcher, so you got into this.
Yeah,
Okay.
at the doctorate level.
Doctorate level.
So then we had to narrow down the whole thing. It's not as vast as our system and as ancient, but definitely a very deep science, Arabic classical music science,
Okay.
which is practiced only in a few countries now. But definitely it has a base where it has evolved from. So then we decided that the topic would be a comparative study of Arabic classical ragas or maqamat. It's called maqamat,
Okay.
South Indian classical ragas.
Okay.
So we narrowed it down. Now, the title is ready. We need to understand each other's science, musical science.
Musical
So my
science.
area and his area. Then the work started.
Okay.
It took 7 years.
The doctorate took 7 years.
Yeah.
Okay.
Because I had to learn. So Dr. Mohammed needed to understand, to help me.
Okay.
So he's no more. He was a doctorate in 3 fields: music, Western, Arabic classical, and another comparative study. So at that point, I didn't know that he's an authority in a very important, niche, unique area, and he has patented a very detailed approach to voice. At that time,
To voice.
yeah.
So there is a voice connection.
Yeah, I'm
there.
coming to
Okay.
that. So it's all like, the universe is taking me around, Then we start. I have to learn Arabic classical music because I am a vocalist. Dr. Mohammed was a vocalist and an oud player. He used to play the oud, the kanun, all these are instruments. So then I start learning, I start getting some problems in the voice. So it's like, it was a cultural shock for my vocal cords. Because I have been in a system which I have habituated by the ear, a system of vocal music I'm talking about,
Okay.
or any music. Habituated by the ear and trained for several years, Carnatic classical and of course my earlier Hindustani vocal.
Correct.
But my vocal cords, because they're muscles after all, very tender, no bone, no nerve there. So they started striking. They said, no, we can't take this style. You need to understand. So I was wondering what's happening to my voice. And during one of the meetings or the sessions that we used to have with Dr. Mohammed. So those are days where we have very good memories. At the same time, we also have memories of anxiety. Because we were in Ruby, Muscat Ruby. From there, we had to drive 120 kilometers to a place called Mawela to meet Dr. Mohammed.
Okay.
And a highly secure place because he's at a different level. The protocol we had to follow. My husband used to drive me all the way.
120 kilometers?
Yeah,
Wow.
at least twice a week. And we start by 9 p.m. in the night. Both of us have to go to work the next day. I also restarted learning Hindustani classical music to understand more about Persian influence.
This was all
in Muscat.
All in Muscat, all about your doctorate?
Yes.
Doctorate,
yes.
Okay. What was your doctorate in?
A comparative study of South Indian classical ragas and Arabic maqamat.
Okay. So your doctorate was in this comparative study, which includes the Arabic classical.
Yes.
Okay.
So he was very clear. He said, unless you learn to sing Arabic classical,
you cannot take
I will not allow you to do this comparative study.
And this took about 7 years?
No, the learning process took about 4 to 5 years, but the work was also, the research was also going on.
Research was okay.
Yeah, totally it took 7 years.
Okay.
So then my voice started giving issues.
Okay.
So I used to visit the ENT doctor. I used to perform there and so. And I was very anxious. When you're a performer, you can't have an inconsistent voice cooperation.
True that.
So then go to ENT. So there's nothing wrong with the vocal cords. And we'll have to find out what other it is. So one day I mentioned to Dr. Mohammed that I'm unable to be part of sessions planned for the week because my voice is not cooperating. Then he said, come over.
Okay.
In his Egyptian English, he said, come over, accented. We go, my husband took me there and he said, it's nothing because the voice is yet to get used to a different style of singing.
Because you've been using a lot of Arabic. This thing. Okay.
Voice production technique. So that's when I first heard there's something like this. Then he said that he's a Voxologist.
Okay.
Which is his another area of work.
Okay.
And it came to light because God gave me that voice issue.
Okay. And you had to go to him
I had to mention that to him.
Yes.
And so then he said, go on a voice rest.
Okay.
It was a very difficult period because I was working as a music teacher.
Got it.
Yeah. But I told you all the factors fell in place and took voice rest.
And that is what drew you to the voice study?
Not yet.
Not yet.
At that moment, I only wanted to get cured.
Okay.
It's always like
I know. Yeah.
You're a singer and voice.
What happened to my voice?
Those days, celebrity male voices used to come from Chennai, Kerala. So I used to be the female voice there.
Okay.
So then I have to be ready all the time.
Okay.
And then, so what we did was, he said, okay, you first get cured after voice rest. I'll put you on some warm-up exercises. After which he said, why don't you do the course, which is a 5-year course.
So he had a course.
Patented course.
Patented course for 5 years.
5 years, which is 4 years plus 1 year of understanding it clinically.
Okay. So that's like the MBBS of voice.
You can call that.
You can call that.
Yeah.
Okay. From the expert.
Yeah. So they are mainly to understand how the voice is produced and what exercises can help, what are the problems and which problem can be helped by which exercise.
Okay.
So it is an overall maintenance of the body and then we come down to the voice.
Then you come down to the voice.
Including the stress level. Everything impacts the voice.
Everything impacts. Your anxiety, stress levels.
Everything. Oh my God. It is a subject and an area which it is a lifelong learning. And it has to be practiced like law, medicine. Otherwise, each person's voice is a case study. So when he mentioned this, my father and my husband said, you are doing it because you have crossed the bridge. It was an expensive course. You do it. And what to say, Gopal, it happened.
Okay. 5 years.
Yeah.
Okay.
Then my the last few years of my PhD and this ran parallelly.
Okay. Okay.
So it was like I was all over the places. My best part of youth went on all these things.
Learning.
Yeah. Still learning, of
Worth-
course. Yeah.
Worth putting your time there.
Of course, yes. And each session with him drew me into it, like a marshland.
Because you already were interested in the voice thing.
Yeah.
Even
that's what
while
I'm
you
saying.
were
Yeah.
singing.
Yeah.
And even while you were the tutor and
Yes.
right?
Yeah.
So the voice was constantly there.
Yes.
But it came to the surface because of this problem.
Yes.
And because of the problem, you did the course.
Yes.
And then you become
Yes. Yeah.
a Voxologist.
Voxologist.
Okay.
So the prerequisite for a voxologist is he or she should have a doctorate in a vocal area. Any vocal
Okay.
music, vocal
Only
area, vocal music.
Music. Okay.
It could be any
so
style.
you did that parallelly.
Yeah.
Right? Okay.
Yeah. So he said, anyway, you're going to finish the course. So you start. So as I'm telling you, I was a chosen one. So
Okay.
till the last moment, I have to. That is how I became a voxologist.
Great. I mean, fascinating story, and like you rightfully mentioned, the universe
Yeah.
comes together
Yes.
for you in jigsaw pieces and
Yeah.
settles it. Right.
Otherwise, I really don't know when we think back, Vinod
Correct.
and myself,
I mean, how
I
do you
was
meet
there.
him? Why do you kind of? I mean, yeah, totally.
Because nobody has done this so far. So how did all these things fall in place?
Great. So you are a voxologist. How would you describe yourself as a voxologist? Are you into therapy? Are you into voice coaching, or both, or what is it? What is the?
So
Or is there more to it? Is there any clinical thing more to this?
yeah, yes. So we are supposed to work with clinical counterparts,
Okay.
ENT specialists, ENT surgeons, because I am a non-clinical therapist.
Non-clinical therapist. Okay.
So I work with Dr. Krishna Kumar from Apollo Hospital.
Okay.
He's now in Perungudi. And then
So you also
I don't
go
have to go
hospitals?
there.
Okay.
When patients come to me,
Okay.
and I feel when they sing, mainly singers, I feel I need a picture. Then I would refer them to the doctors.
Okay.
These doctors
Okay.
only these doctors, because they know what I'm doing.
Okay.
They know the nature of my work
Got it.
and what I'm looking for from that voice. I would just say, doctor, please meet this person.
Okay.
These are, I won't say the issue. I find these in the voice.
Okay.
Then they will know whether to take a picture, endoscopy, VLS,
okay.
or whatever.
So would these be like aspirational singers, performers? All. Anybody. It could be anybody also.
All, yeah.
Okay. But predominantly people in the performance, because
Predominantly celebrity singers, vocalists,
vocalists.
both male and female, more of female.
So how would you describe yourself?
So, as I told you, I'm a professor of music. And as a voxologist, I do both therapy and voice training.
Okay.
Therapy mainly for singers, celebrity singers, amateurs, these reality show,
reality show
participants, because they
participants,
sing a lot and they bring in problems.
Okay.
I also meet orators, pastors, lawyers,
Okay.
especially from the corporate area.
So, which means apart from the performers and the singers,
Yeah.
there is this other crowd who would be in corporates and whose main delivery of work is not necessarily voice,
But they
but
also
they
use the
have
voice.
importance.
Yeah.
They started giving importance to their voice now.
Yeah, definitely.
Okay.
So now there are professional voice users other than singers,
Okay.
like teachers,
Okay.
lawyers.
Hmm.
But from the corporate field, why I get a lot of them from there is
Okay.
they do have presentations. Extensive use of the voice
Okay.
will start aberrating the voice quality.
Okay.
Okay, so I have to handle the voice,
Okay.
not giving them musical exercises.
Okay.
Whereas when singers come, the exercises are based on swaras.
Okay.
A certain, there are people with nasal tone and they want to correct. So I need to teach them exercises where they have to use the pit of the throat.
Okay.
There are resonation or, the vibration is not more frontal.
Okay.
So to open, I have to say, yeah. all that,
Okay.
There are different
The
exercises.
throw of the voice.
Yeah,
per
yeah.
se. Okay.
So the moment when we say therapy, in that, with regard to therapy, there may be common exercises, but who is doing them in which Shruti?
Okay.
That is very important. So what one person is doing, another person may not do the same exercise. But how many times, in what Shruti, how many times a day? Sometimes there are celebrity singers whom I have to put them on, voice rest for 3 months, 4 months.
So
Because
they don't they shouldn't sing at all.
And not
for 3
talk. It's like,
Cannot
thankfully,
talk.
I don't have a remote where I can mute them. But I beg them, please. Because nowadays, there is no surgery for vocal nodules.
Okay.
Meaning, with God's grace, we are taking care, especially for singers, Because, latest BB sir and many singers have gone abroad those days. I'm talking about many decades ago. To get nodule correction, to remove the nodules. But now, then later on in our country, they're doing it beautifully without causing a voice change.
Ma'am, just a break here. What are nodules?
Nodules
Because
are,
we are untrained in this particular thing. So what are nodules? Why do
vocal nodules, that is one of the clinical conditions of the vocal cords, on the vocal cords.
On the vocal cords, okay.
They're like small boils, small, very small.
Boils, okay.
Yeah, that will
Which
not
affect the delivery of the
yes,
voice. Okay.
the voice quality, the facility of the voice,
Okay. Got
breath
it.
control, everything.
Got it. I just
So
thought
nowadays there is no surgery. We are taking care of that without. So that anything without the surgery is better. But it takes a long time. Voice rest and then rehabilitation.
Okay.
So Voxology itself has 4 stages. First is the assessment of the voice.
Okay.
Whoever it is, vocalist or a non-vocalist, we have to assess the voice. A vocalist sings and then we assess. A non-vocalist would talk.
Okay.
We make them talk
Got
and
it.
then we understand. The first stage is assessment. Second stage is rectification.
Okay.
So it is not a one tablet end to the problem. It is a process. So after rectification, we have to go through a period of rehabilitation. Because it should not occur again.
Recurring,
There was a wrong application somewhere. May not even be a wrong application, but a compelled application, very temporary, which has created the problem.
Okay.
So we understand. We ask them, did you talk too much? Did you shout? Like there was a famous singer in Kerala who fell off the 2nd floor. So while falling down, she screamed.
Okay.
So, her condition was polyp.
Okay.
That has to be removed by surgery. So then she couldn't sing properly after that.
Okay.
So these are all case studies. So like that, then after
You
rehab...
mentioned some singer who fell down.
Yeah, from the 2nd floor.
Okay, what happened?
So until then, she was singing with the right voice production technique. It was not a wrong application.
She was on the stage and she fell down from...
From balcony.
Okay.
Balcony. So while falling, she's screaming out of fear. And then there is a small blood vessel which breaks.
And what happened after falling down? She was...
She went to the hospital. But the voice... She lost the voice because she screamed.
With that strain, with that stress.
Stress. That scream was so intense.
Okay.
So the polyp.
Okay.
So those are situations which happen because of some other condition there. Not because of a wrong application.
Got it. Okay.
So then after rehabilitation, we take the singer through a process which is called enhancement. We take care of the entire strength of the voice, take care of the weakness, make the singer understand the strength of the voice, and then teach them methods where they maintain the strength and handle the weakness. There is no perfect ideal voice, Gopal.
There's no perfect ideal.
Yeah, that is what Dr. Mohammed told me, the first statement.
If your audience likes it, you're an ideal
what
voice.
I was saying, see, there are voices...
If you're on the performance business,
correct.
Right?
And there are voices with 99% plus points. They are the voices that we hear. But they will have their own issues.
And they're training perhaps every day.
And they also learn to handle it.
Correct.
So,
okay.
So that's how it is. So we have these 4 stages.
So which means you're a voxologist
Yeah.
who handles therapy, and predominantly your therapy cases are going to be your singers, your
Yes.
performers and
Yes.
stuff, right?
Yeah.
And you have your voice coaching also.
Yes.
Voice coaching predominantly, of course, will be singers, but also will include business leaders or advocates and
Yes.
so
Yes.
who would want a better voice in their professions,
Yes.
right?
Yeah.
Have I got it right?
Very correct. They have from that area also. I've had a lot of people who just come for training.
Okay.
I don't want to mention names,
Okay.
ethics of my profession, but a lot of actors have come to me.
Can you mention
No, I'm not allowed to.
actors? Okay, singers.
Singers I can mention.
Okay,
The K.S. Chitra ma'am, Padma Bhushan K.S. Chitra. In fact, her humility and dedication is exemplary because wherever she's, whichever part of the world, her daily exercises, which we have prescribed for her, she would do and send a audio through WhatsApp.
Wow. Okay.
So many, I don't want to say anything beyond.
Somebody.
Padma Vibhushan Sudha Raghunathan, another dedicated. For many years, I'm meeting all these people regularly.
Okay.
P. Unnikrishnan sir.
Unnikrishnan. Okay.
Yeah. Nityashri Mahadevan.
Okay.
Yeah, we have also worked on Sujata Mohan's voice. She has an issue.
Okay.
These are the names I'm allowed to mention.
Okay.
Ramakrishnamurthy from the Carnatic field, Trichu brothers.
So there are singers who have also said that please don't mention my name.
Yes, a lot of them. So many singers are under treatment.
Because
there are people who come occasionally, take exercises, not on a regular basis, like Srimati Anuradha Sriram, Srimati S.P. Shailaja, all of them. But the names that I mentioned at the beginning, they're regular. Regular.
But I mean, that shows that, I used to wonder, they perform day in and day out, right? They have events most of the singers are your top singers of the country, right? They day in and day out, they have events. I used to wonder, how do they maintain their voice?
That's exactly why they have issues. So I do have singers from Bollywood also.
Okay.
Any top
names?
ranking. No, I'm not allowed to give names. But by now people know. But I'm not allowed to mention. The top ranking ones I'm talking about, they come down. And I also travel a lot, so I meet them.
Any actors who have given permission to mention their names?
No. So the actors we were talking about, they come in to say, please help us to modulate. So especially one particular actor who is doing more of this, negative roles.
Okay.
The antagonist roles. So
which means the voice is very important.
Yeah, he says, see, the same voice in that movie I don't want to use. Please help me to use, low-pitched voice.
Oh, okay.
And some of them don't sing. That's a challenge for me. Because very easy to explain a voice modulation to singers. But some of these corporate CEOs, and they say, how can I make my voice tonally effective?
Okay. Then you have to decide as to what is tonally effective in a presentation.
Based on the strength of his voice. Is it a voice which is going to fade out after 1 hour of talking?
Okay.
Is he able to continue to be assertive? So sometimes they say, we have to be polite and assertive. Firm, politely firm. So how do we do that?
Okay.
So articulation, not the articulation, what I'm talking, articulate with the right placement of the tongue. Phonetics is a huge area which is connected to vocal production, voice production. Okay. Yes.
So now, you have especially with the importance of voice coming into play, it's not just the performers, it's also corporate, it's also anyone, right?
Yes. Yeah.
And it could also be a podcaster like me, right? So voice itself has, the vocal apparatus, right? So you kind of dissect this like a doctor would and say that, okay, the issue is in this part, we need to correct this part. So how does that work out?
So to make it very brief, because we can't go into anatomy lessons. Voice production, like Voxology, has 4 main stages.
Okay.
I'm sure everybody knows, but we'll just go through that.
Yeah, a quick run on, what.
So the stages of voice production is respiration.
Okay.
The lungs are involved. Phonation.
Okay.
The movement of the voice upward. Resonation.
Okay.
Articulation.
Resonation and articulation. Articulation is with the mouth.
Inside the mouth.
Okay.
So when we say articulation, we say meaningful sounds. That is language.
Right.
Yeah. So we are converting that first sound which is phonated here, which is mainly ah. That's a primordial sound, ah, which is then converted into la, ra, sha, saha inside the mouth.
Huh.
So everything matters. How well you use this part, the inside, the hollow space inside the mouth, which is clinically vestibule, we say. And how you place the tongue. You know, of course, a longer tongue is lisp, a tongue tie.
Yeah.
So God is blessed, God has blessed a person and the person is perfect in everything. Okay. If they are not doing that, eventually there is voice aberration. Because you need a healthy judicial use of your lungs, your vocal cords, the sound box, this area. Now you will wonder what this area. Yeah, but people go to the gym, weightlifting, they stiffen here and they say voice is not going up or low.
Oh, okay.
So singers, they need to have a lesson. The do's and don'ts in the gym, even orators.
Okay.
The more this area is supple and loose,
it's better.
the better your voice cooperation.
Okay.
Yeah.
So singers usually don't go to the gym? Is that what you're saying?
No. I don't want to say that. And you can go to the gym, but
I know. You need to have some kind of integrity in this area.
You need to know the do's and don'ts.
Do's and don'ts.
Yeah. Some of them will be taken care of by Keshav because he's specialized in that.
Okay.
So this use of the respiratory system, respiration rather, phonation, resonation, articulation. Yeah.
Okay.
Well taken care of, you have a longer voice, longer life of voice. But this alone cannot help. See, a very simple factor, but we don't think about it. You need to have a sound brain. People don't think about that, Only a sound brain can give instructions to the vocal cords to phonate.
So psychology in play.
No, because when we talk about stress affecting the voice, you will know how the mind controls the movement of the voice.
Do you mean psychology in play? Or
Also,
are you talking about
not
the
psychology.
brain? Okay.
That particular time of the day or the stage when you go on a stage, you are very nervous. It affects your voice.
Yeah.
So what is in here definitely affects here.
Affects here.
For that reason, I'm reiterating that point. A coma patient cannot phonate, but all the other functions are going on.
Okay.
Why the patient is not phonating? Because the brain has not instructed the phonation.
Okay.
So the vocal cords are moving for air. It's at the end of the windpipe. So it's just moving from the time you're born till you exit. Your heartbeat, your respiration, and this giving way for the air to go in and come out. This is all involuntary. We are, by default, we are made that way.
So in this, there is the involuntary processes as well as the voluntary processes.
Yes.
And we are looking at the voluntary aspect of it.
Why?
Right.
Because any meaningful use of the vocal cords, any meaningful use of the vocal cords is intended. So it is voluntary.
It's voluntary. Okay.
Yeah.
Got it.
This nobody thinks. We know. If you actually sit in a corner and think, it's not a rocket science. We know. But when it is voluntary, many of us don't use it judicially. We overuse and bringing problems for the vocal cords.
So you need to be intentful.
Correct.
So
Where to use?
Your intent can affect your voice in drastic ways.
Yes,
right?
of course. In fact, Dr. Mohammed used to say, don't be rude to anybody.
Okay.
It'll leave scratches on your voice.
Okay.
I mean, he used to connect to that, And he says, if you're nervous, if you're anxious, you start panting. That will not allow your voice to move freely. Because respiration, exhaling air, moves the vocal cords. When the brain says phonate, the sound is produced. The sound moves up to the head this way, inside the mouth, articulated.
Okay.
So that is an intention. I intend to speak in English.
Which is why you hardly find angry singers, right? most of the
I
singers
should say yes. Because they are
No, I
putting
mean-
their voice at stake.
Exactly.
Somewhere,
You hardly find angry singers, right? Most of them have a very cool, composed aura to them, right?
They have to be, which they have learned through trial and error.
Okay.
That's why they are there.
That's why they're there.
Because they have put their voice there.
You need to manage
Priority.
yourself
Yes,
well,
yes.
right? Okay.
So I would rate the mind, your emotion, first ingredient.
Top priority.
Yeah. Then the digestive system.
Okay.
Gut health is the heart of voice health.
Okay.
Vocal system is a very special system. It is dependent on all the other functions of the body.
How is gut health?
Gut health, if you have acid reflux, it can kill your voice.
Okay.
Esophageal acid reflux.
Okay.
Yeah.
Okay.
So you need to eat the right food. So there are food items which we say don't touch to singers.
Okay, great. So we'll touch upon that because I need to delve a little deeper into it, right? So now, in terms of your clients who would come to you, right? What kind of problems do they usually come? Let's bifurcate this with singers or performers, and we also have corporates, right? What kind of issues or what is the need? It may not be an issue. What could be the need?
So most of the singers come with a very common, very minimum concern called phonatory gap.
Okay.
So the vocal cords are blessed with a natural elasticity. This is a beautiful moment, vertical, and so they come back. This is called the elasticity. So when there is a gap between them, it's called a phonatory gap.
Okay.
That can be caused by overuse or an aftermath of an infection and still using the voice with an infected vocal area, laryngitis, larynx is there, or any other condition where you should be actually resting your voice, but it's like, you would have used your voice when you should have totally kept quiet, running with a swollen leg.
Got it.
So then the vocal cords, they swell up and they don't come together.
What happens because of that? What is the impact on the singing?
Singers, the entire extreme is shrunk. High pitch, low pitch suffer.
Okay.
Airy voice. Breath control is not there because all the air is wasted. It is also clinically called wastage.
Oh, wastage. So you
Because
need...
the air coming out should vibrate them, not go away
Got
through
it.
the gap.
Got it. Because it's fueled with the air. right?
Exactly.
The voice is
Exactly.
fueled.
Exactly.
Okay. So that is with the singers.
Mainly. So,
Okay.
and then there are other very peculiar issues.
Okay.
Nodules is more concerning than.
Okay.
Then they have palsy, one vocal cord.
Usually these are the... There could be many.
There could be many, but these are the common. Some of them have allergic rhinitis. So sometimes they have wheezing. Then the voice is affected. So they need a period of rehabilitation. Then I give them exercises, breathing techniques.
Okay.
After COVID, a lot of people are coming with less or very minimum breath support for voice.
Okay.
Celebrities I'm talking
Celebrity.
about. From the corporate area, I get people coming to me and saying, every third day I need to talk. And in the night, only air is coming out. It's again phonatory gap.
Phonatory gap.
Yeah, and I need to talk to my team and, appraise them, give them instructions. This is one common problem. Overused voice.
Okay.
Then there is only air coming out. It's very airy.
Okay.
The next day they are not able to talk. So then I tell them, you have to follow a regime and from diet. Maybe acid reflux is...
From diet.
From diet, we have to look into that. There are also... I don't want to mention name, but I would like to share an instance with you. One case study. So this person comes to me and says...
There's a corporate person.
Corporate. Yeah. So there are some 25 people in my team.
Okay.
I'm a very soft-spoken person. I'm not able to be, assertive. I'm not able to drive home the point. They don't respect me because of my voice.
Okay.
So this was an issue. And I was taken aback. Okay, so this is also an issue, I thought, for my case study. Then how do I work with him? Because he's basically a very soft-spoken person.
I know, the character of the personality would be...
Yeah, and he says, I said, see, you have come here. You have reached this level.
Okay.
So there is some factor, somebody has trust in you.
Okay.
That is why you are leading 25 people. No, but I need to talk and I'm not. Believe me, I have to work on his mind first. And then that was one semester we had emotion, mind, stress and voice when I did my Voxology.
Okay.
So then I had to work on the mind and then slowly gave him some strengthening exercises. And all. So many exercises are there. And he improved
Okay.
his voice production technique. First, the voice production technique.
Okay.
Then, how he can be assertive with the needed tonal variation. So, being assertive is not just increasing the volume. The tonal variation.
I know the variation.
Yeah. Literally worked with him for many sessions. He's a very happy person now.
Okay.
So, he sends me messages once in a way. So, that is one, because that is a very peculiar case.
But don't you have to work at a psychological level?
Also,
But
yes.
if the person is not such a kind of person, and only the voice goes right, so there is a dissonance, right? There
Definitely, I have faced that also.
Okay.
But there are most of the cases are cooperative cases because they want a solution when they come.
Okay.
Yeah. So they work. I also work with them. It's like sometimes I have 36 hours a day.
Okay.
Like that I work.
Okay. Do singers have, two voices? I mean, it's wrong to say two voices. Do singers have the singing voice and the talking voice?
Yes.
So this is like they have arrived at a sweet spot, for a performance or something, and they've continued with that. For example, you have, people, there's this rumor that's there in the internet that says that Michael Jackson, has a speaking voice and a singing voice, and you don't know how Michael Jackson really sounds like, right? Are there cases like this?
See, let me tell you one thing. You can't call them two voices.
Okay.
It is voice coming from the same body.
Right.
Not all singers sing in the same vocal space. There is a vocal space.
Okay.
So singers call it pitch, high pitch, low pitch. So it's a space on a huge line. Maybe now I'm speaking in this space. This is my space, pitch level where I'm talking. But when I start singing, maybe my pitch is high. So it won't sound like this.
Okay. Got it.
So Gopal can be Gopal. Or Gopal. So more of head voice, a singer who uses more of head voice.
Head voice is the top.
Yeah.
This thing,
more of upper respiratory tract
So the
modulation.
low will be more with the bass, is it?
Chest. Yeah, those are jargons.
Those are jargons.
Yeah. So the main resonating area is the mouth.
Okay.
Supporting resonating areas are the abdomen muscle, which we call the lungs or abdomen.
Okay.
It's not that in India they say vaitil. You can't sing from your stomach. Voice is produced here.
I know. Yeah.
So what they say is
figuratively
abdominal breathing.
Okay.
That is only way you can have a hand on your lungs. When you inhale, you push your abdominal muscle out. What are you doing? You're pulling the diaphragm out. So the air goes and fills the lungs. The lungs expand beautifully, fully. Then when you exhale, which is when you're talking or singing, you have to actually pull the abdominal muscle in. That's the right way of breathing.
Okay.
So when you draw the abdominal muscle in, contract, the diaphragm comes in. So what happens? The lungs will exhale all the air inside. So this is actually using the lungs to its limit.
Peak.
Yeah. Expansion and contraction. This is a very important thing we have to understand.
False voice.
False voice. So I don't
know if I can call it false voice.
False voice, falsetto is there.
Okay.
So when this is happening, lower pitch is supported by the stomach.
Okay.
Then as the voice goes up in range, pitch, the resonating areas are also moving up. So when the upper respiratory tract, this area is resonating more, we call it head voice. You're pushing the head voice there.
Okay. When you feel the vibration in the head,
you don't have to feel it. It is happening inside.
It's happening inside.
And this is all happening naturally, Gopal.
Naturally.
Only when there is an issue, the therapist will have to remind the person you are not using your head voice properly. Otherwise, by default, anatomically, this is the way we are made. So it is wrong to say don't use your head voice.
Okay.
We have
Okay.
to use the head voice in the right way.
Hmm.
You understood? Many
Got
people
it.
say, don't use your head voice.
Hmm.
No, it is wrong. You don't have a choice.
Hmm.
When you have a common cold, your voice is nasal. Do you have a control over it?
Hmm. Hmm.
That means voice is moving up. Voice itself is coming out from the head.
Hmm.
The mouth is in the head.
Hmm.
But the entire process involves the lower and the upper respiratory tract.
Okay.
So, but if I'm talking like this, I don't have to always sing in this pitch.
Hmm.
You understood? So you can't say the singing voice is different from, okay, that's a very normal, usual way. Actually, what is happening is the singing pitch area is different from the talking area.
Okay.
Sometimes this itself is a way of helping an orator, even from the cooperator, to save the voice. We tell them, speak in your head voice. So they you will feel it.
So over a period of time, they do understand what's a head voice.
We give them
what is
training.
Okay.
So there is less strain on the vocal cords.
Okay. So is there anything like a strong voice, weak voice?
Yes.
And what are the parameters of a good voice? Is there something like a good voice?
See, yeah, of course, there is a very good voices. More of
Okay.
strengths and minimum weaknesses of the voice.
Okay.
So it's not a formula saying if you can tick off 4 here and 4 here, it's a strong voice.
Okay.
No. It's a combination. That's exactly the training we get when we assess the voice.
Okay. So what would you rate what would you say for a good voice or a strong voice versus a weak voice?
Let me use the word cooperative voice. So good is for the listener. It's a very nice
Good is
to
for
hear.
yeah.
So for the singer, a cooperative voice is a voice which helps me in perfect breath control in an area which we call shruti. Pitch.
Okay.
My breath control is good. I'm able to negotiate the ornamentation. In Indian music, we say gamaka, briga, whatever. I'm able to negotiate the ornamentation without going, flat or, and sustain. And my voice is not tired even after singing for 1 or 2 hours. That means I have a very cooperative voice. My intended high and low notes are clear. I'm able to access them. I'm able to move across them. That is a good voice.
Okay. So it's dependent on the person, is what you're saying.
Exactly.
But it is nothing like you say that, okay, the person has this combination of head voice versus this combination of
only
pitch.
when there is an issue.
Only when there is an issue.
So
you have to dissect those and then look into it.
Yeah, it's a very complex thing to do.
Okay.
Because you can't show. See, this is what is happening.
You only see a symptom.
Correct.
Or rather the output. And then you'll have to look at.
Yes, and as a therapist, I have to play chess with their voice, because I can't give exercises which will or which may tamper with their natural strength of the voice. So without losing something, I will have to replace something or remove a problem.
Okay.
By not putting anything else, any other good point at stake, good factor of the voice at stake.
Okay.
It's a huge responsibility.
And we spoke about psychology in the play of voice, right? So what do you think? I mean, many people come with voice issues predominantly because it has a psychological source.
Also,
okay.
So some people come to me and say, you know what, I lost my voice.
Okay.
Then I have to tell them, then how are you talking to me?
Okay.
So that is a kind of fear. They just give up.
Okay.
Then I have to tell them, you won't even be talking to me if you've lost your voice. From there, I have to start. But yes, the mind can play havoc. So there are some very top-ranking singers who are not, they're not very active now on stage because of some
psychological reasons,
issues and some problems in life. One or both the vocal cords are not, they are not synchronized in their movement. One is a sluggish, lazy vocal cord. There is one vocal cord which is not moving at all. Palsy, we call.
So how do you...
it's very difficult because first we have to work
on the psychological part and then
give exercises. We can't cure them totally, but we can bring them half the distance.
But then you'll have to play a role of a psychologist
Yes.
as well? Or
Yes.
you actually get a psychologist to consult?
So far, only in 2 cases,
Okay.
I've had to refer them to...
in extreme
yeah,
cases,
yeah,
perhaps,
yeah,
is
yeah.
it? Okay.
Otherwise, what we do, we sit and record. We spend a lot of time with them. We record their voice and say, see, this is better.
Okay.
And, we have to sit with them. And
Got it.
yeah.
Got it.
Because it has to be a combined approach. It can't be totally clearing the mind so the voice comes. There is a problem which is exaggerated in their mind. And they think that is the level of the voice. So they have a picture of a very exaggerated,
Got it.
hopeless picture of their voice. That is what they are putting into action while singing.
Got it. Okay.
It's a combined approach.
Okay. In fact, one of the articles I was reading recently actually said communication. I mean, this most of the people know that body language is chunk of the communication, right? What you do. And voice comes second, right? The modulation and this thing of the voice, and the content comes last in terms of what you say, right? Is it true?
I beg to differ from
Okay.
that point. Whatever you do with your body language, if the voice is not cooperative, it will not listen to the brain, what the brain wants you to produce. The voice has to be in its form.
Okay. You would say that voice ranks first.
Yes.
Is it?
Whatever be
So
the...
whatever, even
No, you can
bad
have confidence.
bad news said in good modulation will reduce the impact of the bad news.
Exactly. It's all in the articulation,
Okay.
the tonal variation. So you can't say, you can't look confident, body language,
Okay.
and have a voice which is not on pitch.
Okay.
Then there will be so many singers on stage, right?
Just performing. Just
Yes.
using the body language.
That's no, it can't
Okay,
be. I'm sorry to differ from that, whichever article it is.
No, this mainly came from the corporate point of view when you present something
So
to the audience.
not for singers.
Not necessarily for singers, right? It said that, okay, body language, presentation skills, right?
Yes,
The body language
to
and
an
then
extent,
how do you
in that case, yes, you should look confident. Now, what do you want to look as? Do you want to look confident or you want to look as authoritative? So that body language has there also many divisions.
Correct.
All that will show in the voice.
Okay.
So I'm thinking that I'm a very authoritative person. My tone will say that. After all, voice is the first communication of the human body. An infant, a newborn child. How does the infant communicate pain or hunger? It is only the voice. That voice becomes meaningful. A language later on.
The mother will know the...
yes.
Okay,
exactly.
this pitch.
The infant is not going to raise hands when it is hungry. So voice is the first mirror of the human emotion.
Okay.
Unless you are a trained, I don't want to use the word cheat. You're trained to conceal. You feign the emotion. There are people who feign the emotion in your tonal. They mean something. They intend something else.
Like spies.
Spice, yeah.
They can manage their...
Exactly. One actor had come for that. He says,
for the
my
role.
role is that. My role is, till the end, they think I am the best human in the world.
Okay.
So I have to talk like that, but my intention is different. I need to convey that also to
okay. The movie Dhurandhar.
Yeah.
Right? Okay. Oh, so for they come for roles, specific roles
so
also.
they have to sound sweet, but the audience will have to know that
There is a
something is
background.
wrong.
Something is wrong.
Something is
Okay,
wrong.
okay,
That
okay.
is it.
So how do you deliver a performance which makes the audience feel that there is something wrong in the delivery?
Yes.
That will be very
for
nuanced.
That, very, very nuanced. Fortunately,
Okay.
that actor is a singer.
Oh, okay.
So I
Singer
could
and-
talk to him about the space, high pitch,
So they
low
would
pitch.
understand,
Yeah,
okay.
yeah. How to reduce the volume, the dynamics. So, Gopal, how are you, Gopal?
Okay.
So that, some kind of a musical tune there.
Is it a female actor?
Tuneful. Male.
Male. Okay. Can you name the person?
I am not allowed.
Not allowed. Okay.
Yeah. But in the field, many people know.
Many people know. Okay.
Yes.
Okay. Great.
And I don't watch many movies, but that movie I watched after it came out.
Acha.
Yeah.
Okay. How did it turn out?
Very well.
Very well.
Very well.
Okay. Great. So we come to the main section, right? We want, whatever you've learned over your career, whatever your experiences have taught you, your coaching, your, therapy sessions, right? Can we kind of, so if somebody comes to you and they want to have a good voice, they're willing to give time, on a daily basis. They're willing to do those exercises. I know, there's not custom. There's more general.
Yeah.
They want to have a good voice. How would you plan for them? Right? How would you plan for this particular person in the corporate level? They're doing a job. They want to improve their voice and climb the ladder in the corporate scenario, right? What would be your package for them? What would you tell?
Yeah.
Okay, you get up in the morning, do this, right?
There is definitely...
First, you will analyze the voice, of course.
Of course. Right? First is assessment. Then I start working on their breathing technique.
Okay.
I will find out if they are doing the right breathing technique for the voice production.
Okay. So the person will have to first analyze their breathing.
They don't have to. I have to analyze.
You have to analyze. No, they're not coming to you. What can they do otherwise at home itself?
See,
because not everyone has access to
Yeah, that
you.
is true. At home, see, if the breath support is not complete, they will know that they need to take frequent inhalations while they talk.
Okay.
And is the voice becoming airy?
Airy.
See, let's say we talk for about 15 minutes. After that, the volume reduces, the voice is very husky. And the person is takes effort to bring the voice. It's an efforted voice production. That's when they have to think. First, they will have to think about the breathing technique. We are all supposed to be doing abdominal breathing, whether singers or not. That's what God has designed us for. Most of us are not doing that. We're doing shallow breathing.
Shallow breathing, okay.
So that has to be corrected.
Shallow breathing is breathing from the top
without
part of your lung.
involving abdominal muscle.
Okay, so abdominal breathing is your diaphragmatic breathing from the bottom of your lung,
Exactly,
right?
yes, yes. Those exercises, lot of pranayama, methods are there. They can start on that.
Okay.
Then this huskiness will have to be looked at little more with more concern.
Okay.
Not only breath support, they might have to start doing gargling in the night, steam inhalation with the mouth open.
Okay.
Not very close to the water surface, little away.
Okay.
This will remove the inflammation of the day. It's like a daily maintenance.
Okay, daily maintenance.
Yeah.
Okay, got it.
So then they have to observe. After all this, with the breathing corrections or breathing exercises, steam inhalation, they have to check the voice. But before all this, are they drinking enough water?
Okay, hydration is...
Extremely important. You may not be having a clinical dehydration, but you may be having a vocal hydration, which the body will manage. So you need to have a lot of water. All of us should be drinking a lot of water, especially those who use the voice extensively. You don't even have to be a professional voice user. You just can be a person who talks a lot.
Okay, okay.
Everyone has to drink a lot of water.
Hot or cold or...
Room temperature. Only when you have a pain, you should have... See, like, I should be ideally drinking warm water now because I'm in an air-conditioned room.
Got it.
But if you go on drinking warm water, it will dry. It will even remove the necessary lubrication.
Okay. So too much of hot water is also
bad.
Okay.
Need-based.
Need-based.
But water and sleep. There are case studies where we find singers or even non-singers having voice issues because they don't sleep well and sleep in the night, not during the day.
Oh, so they need to keep an eye on the performances they do and
sleep very well.
Very well. Okay.
The well-rested body is a well-rested vocal system. The supporting functions like respiration, resonation, articulation, mind, everything has to be there because like any other part of the body, vocal system is also aging.
Vocal system is aging.
Aging. Elasticity.
So when we spoke about sleep,
water,
breathing
exercises, steam inhalation.
Steam inhalation, right? And
these are very
the maintenance, hygiene for...
Yes, vocal hygiene is extremely important.
Okay. Will the voice get better, or is it just for maintenance?
Of course, it'll get better.
It'll get better.
You know, you're tiring the voice.
Hmm.
The impact in the night is the voice is very gruffy.
Mhm.
That will reduce
Okay.
if you maintain well. The voice will definitely get better.
Mhm. And your impact for your presentations or the way you
Yes.
communicate with people, all that is also going to change
Yeah,
on a
because
daily
see,
basis.
just imagine I need to address my family, the organization, and I have a very tough, gruff voice. I'm not enjoying my own talking, isn't it? I'm taking effort and talking,
It's
so
forced.
I'll wait forced. So I may even curtail the content, the duration. All that will change. You won't feel that, oh, I'm taking effort to speak. It's no more a task. In fact, I'm requesting all teachers in teacher syndrome, vocal syndrome is there. I'm requesting maths teachers and all the social studies teachers to go through this regime of
Teachers
plenty
of schools
subject
and
teachers, schools, yeah,
and okay,
yeah.
okay.
I request them to follow all this. Some of them have acid reflux. With that, they're talking, with that inflammation there.
Got it.
So then I tell them, look at your diet. So now I'm shouting out from the rooftop, after 6 p.m., don't take any gluten content, wheat, maida, avoid.
Okay.
Because it takes a longer time to digest.
Longer time to
Yeah.
digest.
For anybody for that matter, you don't have to be a singer to have a cooperative voice. Everyone needs a cooperative voice.
Okay.
And this is one function of the body which is just taken for granted. Talking and talking and talking. We all come with a prescribed number of hours of work. Just like when you buy a TV, a fridge, the number of hours is prescribed. We have for everything, for our joints, heart, all of us have. It's already prescribed.
Okay.
But we are overusing it.
Overusing it.
Yeah. And we are hastening the process of decline.
Okay.
So now if I have to have 5 to 6 consultations a day, I need to talk a lot. After that, mandatory voice rest I need. And nowadays I'm finding it difficult even to raise my volume because I've used so much, So raising the voice or repeating something is, I feel sad, Okay, I should have saved my voice.
Okay, you're
like
putting
that.
more effort.
Because I'm also a professor of vocal music, so I teach vocal music. I have my own institution.
Okay.
So I have to take care of that.
Okay.
And I'm aging.
Okay.
So
Is there any time of the day where you kind of just keep quiet?
yeah, afternoons.
Afternoons, okay.
Yeah,
You don't want to talk?
No, no.
You just want to rest.
Yeah.
Rest your voice.
Yeah, all the more important because if someone tries to talk to me or I'm just lying down, something very noisy around me, I get angry. Anger is bad for the voice.
Okay.
So it's all very connected.
Connected. Okay. And how do you strengthen? Can you strengthen one's voice, or is it very custom?
You
custom
can
made?
strengthen the
You
voice.
can strengthen.
Yes.
Is it?
To an extent. As I told you, you can't change a voice totally. We can improve upon the strength and teach the person to handle the weakness of the voice. Every voice the percentage differs.
Got it.
You can strengthen the voice. There are mainly breathing exercises.
You can improve your voice. Is it? Okay.
Definitely.
And what would be your? So we come to the finale of the question, right? What would be your hacks? Let's say 5 hacks. We discussed the inhalation and that thing, right?
Yeah.
But to strengthen, like a quick, you're getting into a presentation.
Yeah.
Okay, what do you do now? Do these 5 hacks, and you can manage the situation.
So first, deep breathing,
Deep
abdominal breathing.
Okay.
And
Take deep breaths before the presentation. Okay.
Abdominal breathing.
Okay.
Yeah.
Okay.
Not shallow deep breaths.
Okay.
Abdominal breathing.
Okay.
And if you know it earlier, see that you are well hydrated from the previous day. And if you know it only in 2 hours' time,
Okay.
drink plenty of water.
Plenty of water. Okay.
Not immediately before, then you will have to,
Got it.
you'll be disturbed in between.
Okay.
So, plenty of water, breathing technique, and just be calm.
Calm.
And nowadays, I'm advising everybody, whoever comes to me, to say, try to speak in a higher pitch, not volume.
In a higher pitch.
Pitch.
Okay.
higher pitch.
How would that be?
See, for example, now I'm talking to you like this. I'm going to request you to speak like this so that there is less strain on my vocal cords.
Okay, so this is a higher pitch.
Pitch, yeah. I'm not talking about volume.
Okay.
It is only the pitch.
Okay.
I have raised my pitch now when I'm talking to Gopal. I was speaking to Gopal like this.
Okay.
So this, actually, I can sustain my voice longer here.
At a higher pitch,
For anybody.
Hmm.
It is less strain here. Directly on the vocal cords.
So higher
But
pitch.
on high pitch. Higher than the usual pitch.
Higher than. So if you talk in a higher pitch, it has lesser strain on the vocal cords.
If you are an orator.
If you're an orator.
Not when we are talking across
I know.
the table.
I mean, that would seem a little odd.
Exactly.
Right?
Yes.
So you can do the higher pitch thing?
Yeah, because see, now this is my a natural space, vocal space. But when I have to address a larger crowd, even if I have amplification, a very good system, we all have amplification, I still speak in high pitch because I prefer singing in high pitch. Usually I have to demonstrate a high pitch note. So I go to the pitch which is comfortable for me, which is high. And it doesn't leave me tired.
Okay.
Sometimes I have to talk for 2-3 hours.
Can we have a small demonstration with your voice, ma'am?
I will try because as I told you, Gopal, I've been talking.
Oh, okay.
Okay, so I'll just try.
Okay. So one is we'll have the normal pitch and we'll have a higher pitch, right?
In my case, personally, I can't demonstrate the difference much.
Okay.
And because what
your
I
way of
spoke
singing
in
itself
was closer to my...
Higher, okay.
Tvameva mata cha pita tvameva bandhuscha sakha tvameva vidya dravinam tvameva sarvam mama deva deva.
Nice, ma'am.
Thank you.
So this is the high pitch, what you were talking about. Okay.
Sometimes I sing higher, but today I didn't want to take it. I'm sorry if I
know,
didn't do
it's,
justice.
It's not, it's definitely, if you had the audience, I'm sure you would have gone higher.
Yeah, but I didn't want to also because after this I have another session, I told you.
Okay. Sure. So, thanks a lot for,
Thank you.
joining us in the lab, right? And I'm sure that, all of those listening would be able to take tips and improve their voice. And, thanks a lot for the insights given.
Thank you, Gopal.
And your experience really counts.
Thank you for giving me the opportunity to talk about something which is my life.
Absolutely.
Thank you.
Okay.
Thank you.
Thank you.
Thank you very much, Gopal.
Thank you.